السلام عليكم جميعا، صباح الخير، أهلا وسهلا فيكم في المركز السعودي لسلامة المرضى. Good morning everyone, welcome to our webinar, welcome to the Saudi Patient Safety Center. My name is Mishrif Shihri, Patient Safety Specialist at the Saudi Patient Safety Center. I'll be serving as your moderator today. You will be hearing today from Dr. Anas Amr and Dr. Mohammed Shbeli and Dr. Sliman Al-Umran. They will be speaking to us from standard to impact, how SPSC is shaping the future for patient safety in Saudi Arabia. In the beginning, let's welcome Dr. Anas Amr. Dr. Anas Amr is a highly accomplished healthcare expert with extensive experience in quality and patient safety, accreditation, critical care, and organizations excellence. He has led national patient safety program, developed key policies, contribute to major healthcare transformation initiative. Dr. Anas is recognized for his experts in patient safety culture, just culture, and evidence-based care. He played a pivotal role in developing national patient safety standard, assessment methodology, and safety culture measurement. He holds a PhD in business administration, health economics, and and he is an ISQA fellow and published author for review of patient safety and clinical guideline. Dr. Anas, floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. Thank you, my colleague, Mr. Mishra, for this nice introduction. So, good morning again, and welcome to the World Quality Day. And I would like to take this opportunity to thank you for attending with us. And this World Quality Week have a marvelous theme, which under the title of Thinking Differently. And we utilize this theme to assure that quality without safety is inefficient and safety without quality is unsustainable. So these two ambitions are inseparable, and we must stop treating them as separate silos. And for that, we must think differently. So just a quick refreshment about some definitions, and I'm sure that you are aware about it. Quality, it's defined multiple years ago as doing the right things right the first time and every time, meeting the needs and exceeding the expectation of those that we serve, the right care for every person every time, a service which is free from deficiencies and meets customer needs. And quality in healthcare is the degree to which health service for individuals and population increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So with those definitions, so improved quality will deliver a better patient care at lower cost with potentially higher reimbursement, and it can make our job more interesting, fun, and rewarding. So I'm sure that all of you are aware about this landmark report, which published by the Institute of Medicine 2001, which defined the 6 quality dimensions under the title of Crossing the Quality Chasm. And the first dimension of those 6 quality dimensions is the safe, which means that the quality which should enable us to avoid harm to patients from the care that we provide. When we move to the definition of standards, there is a huge amount of definition about the standards. So simple and quick definition: standards is defined as an explicit, predetermined expectation set by a competent authority that describes an organization's acceptable performance level. Another definition is it's a document established by a consensus and approved by a recognized body that provides for common and repeated use rules, guidelines, or characteristics for activities of their results aimed at the achievements of the optimum degree in order in a given context. So when we develop standards in healthcare, mainly we follow the ISQA guidelines, and every single standard should follow the RAMBA criteria, which means relevant, understandable, measurable, beneficial, attainable, or achievable. When we move to the patient safety concept, so all of you know that patient safety is a fundamental component of quality healthcare, but it still remains a global challenge. Unsafe care is among the top 10 leading causes of death and disability globally or worldwide, affecting populations, and is a significant burden on the healthcare system. And we should keep in our minds that hospitals are complex and high-risk environments that are prone for some circumstances that can compromise patients' outcomes and staff well-being. So the most recent definitions for patient safety from the WHO perspective, they define patient safety as a framework. And when we say the framework, that means multiple actions, multiple initiatives that we need to combine it together to achieve our desired goal of minimizing or preventing the harm. So it's a framework of organized activities that create cultures, processes, procedures, behaviors, technologies, and environment in healthcare that constantly and sustainability lower risk, reduce the occurrence of avoidable harm, and make error less likely and reduce the impact of harm when it does occur. So, as you know, that there is a huge and massive journey and initiative that done to enhance the patient safety, starting from the Institute of Medicine report, the landmark report, which was released and published 1999, which emphasized the burden of patient safety, and when they describe it as an equal to crash of a jumbo jet in daily basis. After that, in 2000, the AHRQ started to commission though the findings of this report to release legislation at the level of USA. The second report in 2001 was released by Institute of Medicine again, which defined the 6 quality dimensions, starting by safety. In 2003, the Joint Commission started to release the National Patient Safety Goals. After that, 2003, the Patient Safety Indicators was released by the HRQ. In 2004, DHI started the first campaign of saving 100,000 lives. After that, the World Health Organization started to describe or emphasize on the global patient safety challenges, starting by the clean care, safer care. In 2006, again, the Joint Commission started to release the International Patient Safety Goals. At the level of Saudi Arabia, as you know, the Healthcare Transformation Program started in 2016 with the 4 pillars. With the most important one is the increase the efficiency and the quality of the healthcare system among the Saudi Arabia. And one of the results from the Healthcare Transformation Program is the initiation of and establishment of the Saudi Patient Safety Centers with 12 variant mandates. One of them is the issuing of the patient safety standards. In 2019, as you know, the WHO highlight and emphasize more on patient safety and designate a World Patient Safety Day, and ended by 2021 by another emphasis from WHO by releasing a decade for patient safety under the title of the Global Patient Safety Action Plan. So it's a massive journey and a huge initiative done by several institutions among the world. But how is our system or healthcare system among the globe nowadays after those 25 years of initiatives and programs among the world? So a recent published reports from WHO in 2023, they emphasize that still there is 1 out of 10 patients is harmed in the healthcare settings. With emphasis in the low medical income countries, there is 134 million adverse events happens every year due to the unsafe care that occurred in hospitals. Another thing in hospital settings, more than 50% of harm, or 1 out of 20 patients, is preventable, half of them attributed to the medication. Some estimates suggested that as many as 4 in 10 patients are harmed in the primary and ambulatory settings. More than 3 million deaths occur annually due to unsafe care. Again, in the low and middle income countries, as many as 4 in 100 people die from unsafe care every year. So, from those 25 years of experience from those institutions and initiatives, there is an emphasis and there's an agreement, there is some or common types of adverse events that may result in avoidable patient harm. Or in other words, that means those adverse events, if you put in place measures, you can protect patients from having them, like medication error, unsafe surgical procedures, healthcare associated infections, diagnostic error, patient fall, pressure ulcer, patient misidentification, unsafe blood transfusion, and venous thromboembolisms. Those we can say that the majority of the developed countries around the globe, they agree, they have an agreement that if you put measures in place, you can prevent those adverse events. If you take a slight look about the cost, which is the other harm or the other hidden cost of the patient safety events, it's the cost. Patient harm potentially reduce global economic growth by 0.7% a year. And if you take a look, the OECD countries, the European countries, they said in their published reports around 15% from the total expenditures, it's went to treat the complication associated with preventable patient safety events. So let's see some emphasize about those special or common adverse events. And regarding to the medication error, medication-related harm affect 1 out of every 30 patients in the healthcare settings. About surgical errors, 10% of preventable patient harm in healthcare was reported in surgical settings. In regard to the healthcare-associated infection, there is a global rate of 0.14%, which increase on an annual basis about 0.06% every year in the healthcare settings. If we talk about sepsis, so of all sepsis managed in hospital, 23.6% were found to be healthcare-associated infections, and approximately 24.4% of affected patients lost their lives as a result of those sepsis. If we talk about diagnostic errors, it's occur in 5 to 20% of the physician-patient encounters, and the harmful diagnostic error were found in a minimum of 0.7% of total adult admission. And something interesting that most people will suffer a diagnostic error in their lifetime. If we talk about patient falls, which are the most frequent adverse events that occur in the hospital settings, their rate of occurrence ranges from 3 to 5% per 1,000 bed days, and more than 1/3 of these incidents resulted in injury. If you talk about VTE, so it's contributed to 1/3 of the complication attributed to the hospitalization. If you talk about the pressure ulcer, so it affects more than 1 in 10 adult patients who admitted to the hospital settings. And when we talk about the transfusions practice, there is a huge amount of those practices among the healthcare settings. Misidentification, another hidden danger. And in a published report by Joint Commission, there is around 409 sentinel events related to patient misidentification out of 3,000 plus incidents. And finally, about the unsafe injection practice, there is a huge amount of incidents reported related to hepatitis B, C, and the HIV. So all of those and more about those common adverse events still happening, even of the global initiatives to prevent or minimize the harm and unsafe care that is combined with the hospitalization. So from that perspective to this slide, so who drives the quality and patient safety in Saudi Arabia? And this post was posted by one of our colleagues in the social media, and I would like to share it with you. So if we talk about the healthcare ecosystem in Saudi Arabia, there is 3 major parts that drive the quality and patient safety in specific and the overall healthcare system in Saudi Arabia. Regulatory parts like Ministry of Health, SPSC, Saudi FDA, and Saudi Patient Safety Center. Providers like MOH, non-MOH hospitals, and private sectors and payers. So those 3 pillars with the MOH as super regulators drives the healthcare ecosystem in Saudi Arabia. So with a specific focus in the Saudi Patient Safety Center and its mandates and initiatives and programs to drive the patient safety among the Saudi Arabian healthcare ecosystem. So Saudi Patient Safety Saudi Patient Safety Center have several mandates. One of them, which under the article number 3.2, it's stated that issuing standards, best practice, and models in the field of patient safety to be applied by the healthcare practitioners and organization. And the aim of this mandate is to develop a national framework for patient safety standards, reflecting global best practices and models to promote safe practices in hospitals. And this is very important because those set of standards can be a national framework for governance and contributing to the improved quality and efficiency of healthcare. It will promote the excellence in patient safety and achieving the optimal healthcare outcomes, and it can be used as a tool to facilitate the creation of updating of programs designated to support existing patient safety efforts. And the result of that mandate, so we developed and released the patient safety standard book last April 2025, and it's available in our website, and you can access it without any charge. So there is a huge value of releasing the patient safety standard at the macro level, which the healthcare ecosystem. It's a national framework to govern and contribute to improving the quality and efficiency of the healthcare, and it contribute to the implementation of the goals and objectives of the Global Patient Safety Action Plan at the national level. At the meso level, which the healthcare facilities, it's a tool to serve facilities in assessing patient safety practices and addressing areas for improvement, and it's a proactively enhance patient safety practices by taking preventive measures. At the level of micro or patient and healthcare practitioners, it is a tool to empower practitioners and building capacity in the field of patient safety, and it aims to empower patients and their family. So if we look to the patient safety standards and their expected impact, so at the level of Saudi Patient Safety Center, it will enable us to meeting the mandate. It's a map to achieve mission and vision. It's a lens on patient safety perspectives and a metric for surveillance and monitoring, and it's a national branding tool. At the level of the healthcare ecosystem, it's a framework to advance patient safety. It facilitates the implementation of Global Patient Safety Action Plan. It can be used as a metrics to be used for accountable care organization or pay for performance. And it reinforced the accreditation efforts, especially the ESR and the international patient safety goals. And it's a structured journey for the high-level organization. At the level of healthcare organization, the expected impact, it can be as a situational awareness at the starting point. It's a framework with an action plan, and it's a stepwise improvement, and it will fulfill the satisfaction and the desire for recognition. At the level of the healthcare transformation, it can be used as a metric for transformation maturity. It will enable best care, best healthcare providers, and it will assure the sustainability and cost. At the level of the patient and public, it will assure the trust relationship. It will assure the patient satisfaction, and it's a tool to empower patients and families, which will be ended by less harm. And all of those impacts will serve the Saudi Arabia vision by improving quality and the efficiency of the healthcare. So, moving forward and behind the releasing or developing standards, so we, at the level of Saudi Patient Safety Center, we take one step in advance, and we release the implementation methodology, and we talk now about the patient safety standards as a patient safety standard certification program, which a national patient safety certification program designed to recognize and reward hospitals that adhere to, comply with, and monitor patient safety principles and best practices. And for this aim, we develop a second document which is called the assessment guide, which will facilitate the implementation of those set of standards at the level of organization. So patient safety certification program, it's a voluntary program for this moment, until this moment, done through an external evaluation environment. It will assess organization commitment to a preset 10 patient safety domains, done through a self-assessment methodology at the level of the organization, and the data and evidence will be validated from multiple levels by the Saudi Patient Safety Center, and it will be ended by the rewarding the level of commitment or a commitment by through the organization. So this experience is available among the world and through the developed healthcare system globally, like US, UK, and China, and as well the WHO. And if we zoom in those systems to the pure patient safety standards or rating systems, we can see that the Global Patient Safety Action Plan, it's a framework of 755, consists of objectives, strategies, and the criteria done through self-evaluation, and it will share with the country a progress level about the progress and the patient safety. If we take another initiative by the WHO, it's Patient Safety Friendly Hospital. It's a regional initiatives, consists of 5 domains, 21 standards, 134 criteria done through self-evaluation, and ended by a report or a comprehensive report with recommendation, and can be confidential or public. If we take a look about the third pure patient safety rating system, it's the patient safety grades under the Pioneer Institution, which is the Leapfrog institutions, consists of 22 measures. And they can drive it directly from CMS, and in addition to a survey process, and ended by a rewarding letter starting from A to F grade according to the compliance level of patient safety. Another system is the 5 stars rating system, which initiated by the Patient Safety Movement Foundation, which consists of 21 actionable patient safety solutions done through self-rating and ended by a recognition of 5 stars level. And finally, the Safer Together initiatives launched by the IHI. It's a national initiative, consists of 4 domains, 17 standards, 75 tactics. And the aim of this is to be used as a situational awareness tool. So moving forward from those patient safety designated systems, and taking a specific look about those experience among other countries, especially in the OECD's countries, we can see that here this experience is applied and practiced. There is several institutions here, as you see, the national set of indicators, national quality and safety agencies, national patient safety standards, national patient safety program. So multiple initiatives within the same countries that used, those countries use those several systems to advance quality and patient safety, and they did not look to those systems as a burden, but they look at those systems as layers. Every time they add another layer to prevent and minimize harm from receiving or achieving the patients. I will emphasize more on the patient safety action plan. So there is a clear standards in the global patient safety action plan that nudge the countries to take action to develop standards and to have a monitoring tool and to have rewarding mechanisms. So as we see, there is a huge amount of emphasis on developing standards and implementing them at the healthcare ecosystems. And there is a huge benefits from those initiatives. If you can see the slide here, this is one of the a lot of values that done by the Leapfrog. This is a published report, 2016-2019, about the importance and the impact of the Leapfrog patient safety grading system. And they conclude that if the hospitals with grade F, D, C, B change their practice from the current practice to the one that practiced by hospitals with grade A, they can save 50,000 plus lives. So patient safety standards, which released in April 2025, is a national governing framework. It aims to govern and contribute to improving both quality and efficiency in the kingdom. Critically, it serves as a vital assurance layer, providing auditable proof that our quality governance is working. So safer healthcare, that means high quality healthcare, which enable us to achieve the vision of 2030 national goals. And we can conclude that patient safety standard is a national blueprint to make this equation a reality. So the skeleton of the patient safety standard, we develop those set of standards under the framework 1055 framework, which means that 10 domains, 10 patient safety domains. Every single domain have 5 designated criteria, and every single criteria have 5 pieces of evidence or measurable elements to achieve those criteria. And as you can see, there is 10 domains, and those are pure patient safety domains. And there is a huge journey behind the development of this framework. More than 300 published peer-reviewed patient safety articles were reviewed to have a look in the best evidence available. More than 10 patient safety organizations, we access their portals and their materials to have a deep look in the patient safety best practices. More than 5 pure patient safety framework, we utilize their methodology to develop this framework. And this framework was reviewed with more than 30 patient safety experts at the level of patient safety center and outside the center. And this framework was piloted in 10 volunteered hospitals to see the feasibility and applicability of those standards. In addition, we utilized 2 models, the IOM STEEPS or 6-dimension models and the Danabedian models to develop those sets of standards. And if you can see the patient safety standard book, there is a criteria, there is a description of criteria, and there is 5 pieces of evidence. And under every single evidence, there is an assessment guide, which will come in the next page here, as you see in the left side of the screen. The criteria, we will have a 3 designated and full description about the level of complaints that you should assess your organization against it, satisfactory, partially, and non-satisfactory. And we will add more explanation about how to achieve the satisfactory level. Actually, this book still not released for the healthcare organization, but if the organization registered with us to be in the cycles for the certification, they will get this book that we have the full assessment guide. In addition, we have now a scoring matrix, a rewarding matrix, a clear patient safety standard application process, and a clear and robust patient safety assessment process. And we automate those processes to make the process easy for the healthcare organization and easy for the patient at the Saudi Patient Safety Center. So we automate this process from application to self-assessment to verification process until the results and detailed report. So finally, your action must reflect the theme of think differently. When we talk about think differently, that means we should look to those set of standards not as a burden or another burden for the healthcare ecosystem. We need to look about those set of standards as another layer to prevent or minimize the harm from reaching the patients. So your immediate investment in safety is a strategic investment in quality. If you are interested to lead the change, form a designated team, do a gap analysis, set your priorities, and if you are ready to lead the change, contact us via the project email, pss@spss.gov.sa, to schedule you in the coming or in the next certification cycles. And we need to announce for you that the first certification cycle will be next January 2026. Thank you very much. And by this, I will end my presentation, and the floor is over to you, Mr. Mishra. Thank you.
Yeah, thank you so much, Anas, Dr. Anas, for this excellent presentation that is really important to reshape our patient safety. For the question, please, you can write your question in the Q&A part, and we will discuss all the questions in the end of this presentation. We will move to the next topic. We will welcome Dr. Mohammed Al-Shibaili. He will be presenting to us the Patient Safety Award. Dr. Mohammed, he leads National Evidence-Based Initiative aimed strengthening patient safety culture and improving healthcare outcome across Saudi Arabia. His work bridges research and practice, translating to evidence into policies, program, solutions that enhance system reliability. He is known for guiding a multi-stakeholder project from design to implementation, ensuring their scientific rigor, real-world relevance, and lasting impact on a safe care. Dr. Mohammed, floor is yours. Go ahead.
Thank you, Ustad Mushrif. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah wa salatu wa rasulullah. Thank you all for coming to this session today. When we are talking about quality and enhancing the healthcare system in our beloved country, the National Patient Safety Award become one of the hot topic. We have this year the 8th edition of the National Award, and we are really proud of this project, having been since 2018, aiming to identify successful patient safety initiatives or innovations and best practices that serve as exemplary models and are widely disseminated and applied across healthcare institutions to enhance and improve healthcare safety. This is what we all care about in healthcare, with the goal of achieving safer healthcare with the standard at the national level. It's aligned with the mission of the Saudi Patient Safety Center to recognize innovative applied project reducing patient harm and promoting creative way to improve the patient safety in the Saudi healthcare system. This is why we decide to have the values of the award to foster innovation, recognize outstanding best practices, motivate improvement across the Saudi healthcare sectors, and promote safety culture. From this, the alignment of the National Patient Safety Award, it's become from the Vision 2030, a vibrant society, and supporting improvement and innovation efforts in the patient safety from the Transform Healthcare Program. That make the Saudi Patient Safety Center aiming to achieve innovation and patient safety through this award. How? By knowledge exchange between sectors and benefiting from other experience from the best practices that been presented at the award, health transformation through innovation, and rising and enhancing patient safety standards. So this Vision 2030 for an ambitious nation become stronger with the health transformation that make the our healthcare system safer. The award is open for multi-categories. It starts with the healthcare organization, healthcare professionals, and the community and organization. So either you are a hospital or in primary healthcare, pharmacist, if you are a leader, if you are a physician, nurse, or if you are a community figure, if you are a government organization or non-government organization, if you are an insurance company, you are welcome to apply for the award if you have this impactful or successful story that you think, if it has been applied nationally, will make a difference for patient safety. Through years since 2018, we have moved from 200 applicants to reach 1,200 applicants. Through that, we can see maybe around 2,500 or 1,300 applicants within the years. From those 98 successful stories that help to improve the patient safety, that helps to reduce death and reduce harm in our healthcare system. We are really proud of that. And here are some really proud moments that we experience with the applicants every year. And we really, really want to have you this year, inshallah, with the award. This year is a special. We have a very specific 9 tracks that we think will make a change on the patient safety concept. So we decided to have students and researchers to have this track to help us all, to help us understand the concept of patient safety differently from the research side and from our student or resident. On the other side, we have a very important pillar when we talk about patient safety, which is the patient themselves or their family. So patient engagement for their safety is one of the major tracks that we really emphasize every year. Maternal and newborn safety, a very important one, and I will talk about one of the successful story in this track later on, inshallah. Training for patient safety, choosing wisely. Those are also a track that focus on how we can improve the value-based care in our healthcare system. Medication safety, general patient safety track. In this general patient safety track this year, it includes also the surgery, the diagnostic issues, etc., to be on this big umbrella with other relevant information. The infection control and prevention, this is one established track specified for this year and inshallah for the coming years, to know and to see the best practices, how our healthcare facilities fighting the infection control and prevention and for the patient. And we come now to the most, I believe, important part, which is the leadership in patient safety, because we believe the leadership can promote, enhance, and advance patient safety by their role to make it a really consistent on every step that we do with our patient in our healthcare facilities. Here, as I mentioned earlier, the stories of successful from the National Patient Safety Award is a lot. And I would like to refer you to the website of the award and also the YouTube channel of the Saudi Patient Safety Center. So you will find multiple projects that has been announced and how they reach that. One of the successful stories from transition of care for cardiac patient. So the summary of this project was to enhance safe transfer and care continuity for cardiac patient by engaging patient and improving handover protocols. That results to reduce medical error during care transition and increase patient satisfaction. One of the really proud project is the Code Purple for massive blood transfusion during birth. The summary of this was to introduce a rapid response called Code Purple for life-threatening maternal bleeds. And the key result is to reduce response time for blood transfusion from 45 minutes to minimize that time up to 15 minutes only. That leads to achieving 0 deaths or hysterectomy since implementation. A huge proud and for the maternity and children hospital at Al Kharj. Urgent care clinical integration from King Khalid Hospital. The summary of their project was to establish integrated urgent care with the primary care, streamlining the emergency department process. So in that project, the shorter wait time and reduced burden in the emergency service by this project. One of the project that also got the award was the Smart Bed Notification Fall Prevention, and that was the advanced bed alarm system to alert staff and prevent patient from fall, and that was a notably decrease in patient fall incident. These maybe summarize the different concepts that we can introduce and implemented in our healthcare facilities to support our patient and our beloved community. I'm coming to the end with thank you again for making the time for the Patient Safety Award. And we would like to see many applicants to apply for the award. And I believe we have a very unique professional, healthcare professional, and many ideas, multiple ideas I've received. I'm not exaggerating, but it's hundreds of emails and calls and WhatsApp messages asking about how we can share with the National Patient Safety Award. And we welcoming all of the applicants, and we support you with the guideline that we published, and we hope to see you one of the winners of this year. Thank you again, and back to Mushraf.
Thank you, Dr. Mohammed, for well-informed about the award and how it's progress to reach this part. As I said before, please write your question in the Q&A part, and because we have short on time, we will move to Dr. Sulaiman Al-Umran for presenting the bridge from standard to real impact through the empowerment. Dr. Sulaiman Al-Umran hold PhD in Health Informatics and Master Degree in Health Information System. Dr. Sulaiman worked as Medical Informatics Faculty at College of Medicine in King Saud University and Health Information and Informatics Consultant to the Saudi Commission for Health Specialists. and Saudi Health Council and National Health Information Center in IHC. In the past 5 years, Dr. Suleiman worked as a clinical coding director at Clinical Coding and Costing Program under Center of National Health Insurance, CNHI, and currently is working as an empowerment manager at Saudi Patient Safety Center. Dr. Suleiman, floor is yours. Go ahead.
Thank you, Mashra. Thank you all. Considering the time, I prepared a very short, high-level strategic overview of the role of the Empowerment Department at the Saudi Patient Safety Center. So how do we think differently in changing the system and improving the quality using patient safety? Okay, so in general, there are barriers of patient engagement in the healthcare system for patients and healthcare professionals. Cultural specifics like related to culture, failure to identify suitable patient advocates, or for example, psychological safety of healthcare professionals, lack of leadership and understanding, absence of infrastructure for the healthcare organization to support the activities, to support the professional development, or to support the patient engagement, or maybe lack of funding, or maybe these all are due to lack of funding sometimes. So in general, how do we work at the Empowerment Department? We try to bridge from which is what the patient safety standards, the national awards, criteria, and other national policies published by the Saudi Patient Safety Center to the how side. And we try to enable organizations either by working on them or making resources available so they can implement the standards which drive success and shape practice effectively in healthcare, inshallah. What is empowerment in patient safety center? Who do we focus on? We focus on clinical empowerment, patient empowerment, and organizational empowerment. Clinicians, for example, we strive to make professionals gain skills for better decision-making and avoid harm related incidents to patients. Patients, on the other side, we try to empower them through making them actively participating in their care decisions and reporting, for example, when they see an incident or they're concerned about their safety, how do they report this to the organization or to the other concerned bodies? At the higher level, for the organizational level, we try to make leaders more effective, transparent systems, and supporting healthcare. So getting them engaged in, for example, day-to-day, week-to-week, month-to-month, and quarterly meetings, reportings, making cultures available, or just culture in the healthcare organizations. Here is an example of our initiatives at the Empowerment Department. For example, they should be in two different colors. The first one is the patient safety course, for example. This is to the clinical empowerment or the healthcare professionals empowerment. We have developed a course that is self-paced 2 hours, and it's already working now for the third month, approved by the Saudi Commission for Healthcare Specialties. And we aligned this course, for example, with the requirements of the Saudi patient safety standards, where they ask to train healthcare professionals on patient safety, have documentations that they have trained them on. We make a dashboard available for healthcare organizations to monitor and ensure that their employees in healthcare or related fields are taking the training. For example, we have Safety Champions Network, which is composed of over 20 experts in patient safety and quality in the Saudi healthcare system, where they are available to support healthcare organizations to deliver other types of training, on-site training. For example, the root cause analysis and the other related courses like human factor. On the other side, for patients, we have Salama Friends program, for example, which targets children empowerment. This is already running for 6 years, and over 1 million children already in Saudi Arabia have taken the program. It is delivered in a specific method, and we can share the summary and the details of the program if you want to implement it in your organization for kids or pediatrics clinics. We have a new program, national program, which is called Sautic Reporting System, which empowers patients to report their incidents and their concerns to the Saudi Patient Safety Center. Also, we have Choosing Wisely program. This is how we empower the healthcare organizations, healthcare practitioners, and patients at the same time. We try to target low-value care or inappropriate care in healthcare settings. We say always more, it doesn't mean better. Like more procedures, more medications, doesn't always mean better care. For example, patient empowerment framework. This is a national framework that we are working on now to develop competencies and domains for patient engagement in healthcare according to their healthcare domains. For example, sharing decision-making process for patients in oncology clinics. For example, what do they need? We're interviewing patients, healthcare providers, organizations, and the national healthcare centers. This is ongoing framework started this month. Also, the last two is empowerment workshops. We deliver empowerment workshops to organizations. We train the organizations on how to train patients or how to teach patients and educate them and increase the awareness of their participation in healthcare. And we have annual webinars like this one to increase knowledge and safety culture inside the healthcare system. So we encourage questions and transparency in the healthcare system, share learning from incidents and no blame culture, support just culture and safe reporting, then participation in improvement projects. Here is one example for choosing wisely. This is one initiative in one hospital in 1 month. The procedure numbers dropped almost 5,000 procedures when we adapted and trained them on how to use Choosing Wisely. Pharmacy, for example, dropped the orders from 2006 to 700 plus. Another last example from Choosing Wisely is the so here is the numbers of the 18 hospitals participated in Choosing Wisely in 28 initiatives. We have over 100 initiatives that met choosing the results here that met Choosing Wisely criteria. For example, the requests avoided in the 28 hospitals were almost 12,500. Annually, over 150,000 low-value care was going to be delivered to patients, but through Choosing Wisely, we minimize that. Economic burden over, like for example, monthly was over 7 million riyals, and annually was almost 90 million riyals. Considering the adoption and the pilot was only manual and the reporting wasn't used through the electronic medical records, so the numbers could be better even. Here is Saudi the برنامج تدريبي لسلامة المرضى through the website that I mentioned earlier. It's already going on, and we have already awarded more than 6,000 training hours for free. And here is Salama Friends program that have reached over 1 million students in elementary schools in Saudi Arabia. Thank you all, and back to you, Mushraf.
Thank you, Dr. Sulaiman. We will discuss really quickly a few questions were asked already. I think there's one question for Dr. Anas so far. Actually, two questions. Do you have a checklist for patient safety standard for each domain? And I think the other questions kind of related because they are asking about guideline of how to implement the patient safety standard. Anas, please.
Yes, Mushraf, thank you very much for this question. So, yes, we did not call it as a checklist. We call it as an assessment guide. Every single information that you need to achieve the intent of the standard is available in the assessment guide, and it's categorized under 3 levels of compliance: satisfactory. That means what you need to have to fulfill 100% the requirement of the standard, partially and not met. In addition, after those three categories of explanation, you will have a hint or guidance, another guidance. It will direct you to some specific elements and requirements that you need to do it or to achieve it if you want or if you have a desire to fulfill the full compliance of the standard. Yes, it's available, Mushraf, and it's in the assessment guide. It's not released in the website, and it's only exclusive for institutions who registers and approved for to be scheduled for the coming future assessment cycles. Thank you.
Thanks, Anas. Dr. Mohammed Shibeli, really quick questions. How and where they apply for the Patient Safety Award? Just really quickly, where to find the link?
Thank you, Brother Mushraf. The link is in the website, award.spsc.gov.sa, and the guideline are in the website. So I refer them to the website. The platform now we are accepting the applicants, and the deadline is approaching. It's the end of November. So I really encourage everyone to look at the website immediately today and take action.
All right, thank you, Dr. Mohammed. Actually, we reached the end of our presentation today. On my behalf, on behalf of the Patient Safety Center, I would like to thank Dr. Anas, Dr. Shibeli, and Dr. Al-Umran, and the audience for their active participation as part of the Saudi Patient Safety Center effort to provide you all the timely topic interesting speakers. We would appreciate it if you would fill out the evaluation survey provided at the end of this session. Thank you for joining us today. We look forward to welcome you back in the future for future webinar. Thank you so much. We appreciate your attendance.